Okay. Alright, I'm going to do hand hygiene. My name is Altland. I'm your nurse today. I'm here to do a physical. Looking at my patient, she is a well-developed, well-nourished 54-year-old female. Can you tell me your name?
Melissa Altland.
Date of birth?
December 31st, 1970.
Can you tell me what month and what year it is?
April 2025.
Can you tell me where you're at?
Doctor's office.
Why you're here?
For physical exam.
And who the president is?
Donald Trump.
Based off this, I would say my patient's speech is clear and intact. From here, I'm going to do my deep tendon reflexes, get that done with. I put it at the beginning of the video. So first I'm going to start off with my bicep reflexes, which does C7. And then we're going to do our tricep. So the bicep one, they're going right above the antecubital fossa and looking for flexion of the forearm. Okay, and going to, reflexes are intact bilaterally. I'm going to have you relax your arm. I'm going to have you dangle it, and I'm going to go right above the elbow for the tricep. Okay, looking for flexion of that, or extension of that forearm. Okay. And then I'm going to look at the brachioradialis, or the radial brachialis, I'm sorry. This one also tests C6. Looking for a little bit of pronation of that hand. Supination, sorry.
Just a second.
Supination, feeling that radial bone, going a couple centimeters above. Okay, looking for supination of the hand. I'm going to be testing our quadriceps, and this is going to be testing our L4. Can you dangle your legs for me? Okay, looking for flexion.
Sorry.
Now we're going to be doing our ankle reflex, and this is going to be looking at S1. Okay, looking for flexion of that foot. Okay, and we're going to be doing our Bushinski, going from the bottom of the foot to the top, looking for curling of those toes. An abnormal Bushinski would be flaring. Okay, so I would say all of my deep tendon reflexes are intact, as well as a good Bushinski assessment. Okay, to continue my neuro exam, I'm going to be testing muscle strength. So I'm going to start with the push against me, push against this side, push on the back, push forward against me, and push down. Shrug your shoulders. Awesome. Patient did all those movements equal bilaterally and strong. You want to squeeze my fingers for me, push up against me, push down, relax your feet, push up against me, push down, push against me, push back. All those movements were equal and strong bilaterally. They'd be a 5 on the Oxford scale. Now we are going to do sensation. Okay, I'm going to have the patient close her eyes, and I'm going to have her tell me if she feels me touch her something hard or soft and what area of the body.
Hard upper arm. Soft lower arm. Soft upper arm. Hard lower arm. Hard upper leg. Hard lower leg. Soft upper leg. Soft lower leg.
Patient was able to tell me all those things. I would state that sensation is intact. So next, I'm going to have the patient stand up, and I'm going to have her take a couple steps that way, and then we're going to have her stop and turn around and walk back on her heels. Okay, and then I have her turn back, walk on her toes. And then I have her turn around and walk from heel to toe like a drunk driving test. All right, patient's gait is intact. No abnormal movements there. You can sit back down. To finish off the neuro assessment, I'm going to assess the patient's pupils. How do you look straight ahead? Pupils are brisk, about a size 4. Equal round reactive to light, and then I'm going to do indirect response, looking at the other eye, and responds equally. Okay, and then I'm going to do accommodation and have you follow my pen light to your nose, and eyes move downward towards the nose, so the accommodation is intact. Looking at the patient's nose is symmetrical, no abrasions, no nasal flaring, no cyanosis around the mouth, no pursed lip breathing. Mouth is pink, moist, intact, so no signs of respiratory distress, and by any means. Looking at the neck is symmetrical, no jugular vein distension, no accessory muscles used. We're going to be looking at her carotid pulses, assessing one at a time. And then I'm also going to be, no thrills were present, listening for any bruise. And no bruise present. Alright, now we're going to be moving on to the lung assessment. Looking at my patient, no accessory muscles are being used, no labored breathing, no muscle retractions, no barrel chest. I'm going to mess these up, the pectoris extravatum and pectoris carnitatum, looking for any deviations in the lung area. Now I'm just gonna, no shortness of breath, no tripoding. Patient is not doing anything extra to breathe. I'm going to palpate this area. I'm just gonna be feeling for any extra vibrations. I'm gonna do 4 spots in the front and 6 spots in the posterior side. So just feeling, no extra vibrations. And breathing is normal. Now I'm going to be auscultating. I'm going to be using 6 spots in the front, 8 spots in the back, and then 3 spots laterally. More important on the right side is there's 3 lobes on the right and only 2 on the left. Listening for any adventitious lung sounds, like bronchi, wheezing, crackles. Lift your arm up. And lift this other arm. Alright, patient had clear lung sounds bilaterally, no adventitious lung sounds, no bronchi, no wheezing, no crackles present. Now we're going to move on to cardiac. no heaving present, no extra muscles to pump blood through the body. Looking at that chest wall. Next, I'm going to palpate, I'm going to palpate the valvular areas of the heart. So first, I'm going to start with the aortic, which is right mid clavicular line, and then I'm going to go to pulmonic, Erb's point, which is mid clavicular line on the left, and second intercostal space is pulmonic. The third is Erb's point. Tricuspid is the fourth, and then the mitral is also why am I drawing a blank? The apical pulse. Can feel that there as well, which is strong and regular. Also can hear S2 at Erb's point the best. No thrills were present while touching any of those valvular locations. So now I'm going to listen to all those spots with both my diaphragm and my bell. Okay, while listening, S1 and S2 were heard. No murmurs, no S3, S4, no pleural rubs, anything along those lines. And going to be listening for any bruits with, like that. You can also put the patient in different positions if you're unable to hear heart sounds, like have the patient lay flat or lay on their left side. Anyways, yeah, no adventitious heart sounds. S1 and S2 were present. To continue my cardiovascular assessment, I'm going to be looking at pulses, temperature, and cap refill and edema. So first, I'm just going to look at cap refill bilaterally. I'm going to hold pressure, and cap refill was less than 2 seconds. It was brisk. Cap refill is intact bilaterally and equal. And then looking bilaterally, going to hold pressure. Cap refill is less than 2 seconds and equal bilaterally. Now I'm going to be looking at any edema. Patient has no edema noted in her upper extremities and no edema noted in her lower. Also can kind of do this while I've been doing this, but touching her quite often, but feeling with the back of my hands. Patient is warm and dry. All extremities have signs of perfusion. Also going to be looking at her pulses, making sure those are equal and strong bilaterally. So we're looking at her brachial, which are equal in +3 bilaterally, radial, which are equal +3 bilaterally. Normal patients, you'd be looking for femoral, which is located in the groin. We're not doing that. We're looking in the back of her knees, posterior. Those are equal and strong bilaterally. Behind her ankles, which are equal and +3 bilaterally, and her pedal pulses, which are equal and +3 bilaterally. Awesome. I believe now we're to our GI assessment, so we're going to have her go lay down on the couch. First, I'm just going to inspect the abdomen, making sure no bruising, no extra bowel movement, abdominal movement, looking for ascites, like cirrhosis, looking for any vein distension, especially around the umbilicus, and yeah, any abnormalities. First, I'm going to listen. I'm going to listen to all 4 quadrants. Alright, bowel sounds are active in all 4 quadrants, and now I'm going to be listening for the aortic, renal, and iliac arteries. Real patient, you would listen for the femoral. I'm going to be using my bell to listen for any bruits or yeah. No bruits heard in those areas. Next, I would palpate the abdomen, feeling for any masses, distension, and just making sure the patient isn't feeling any tenderness in those areas. So I'm going to do all 4 quadrants. Alright, patient had no tenderness in her abdomen, no distension, no masses felt. And then lastly, I'm going to do percussion. Alright, well, percussing the abdomen, all areas of the abdomen felt hollow besides that right upper quadrant, and percussion was intact. Overall, patient had no abnormal findings in her physical exam, and that is the end of that.